In the old days, in the 1970s, when you did the windows, we packed the nose, and the nose had lots of bleeding. And when they pulled the packing out, and people said, I don't want any sinus surgery anymore. What's it like with the newer surgery? Do you have bleeding? Do you have packing? Do you have the miseries after the surgery?
Yeah, there's so much fear and misconception or misperception of what sinus surgery is because of those old days. Modern sinus surgeons typically don't pack the nose. There tends to be less bleeding. The lack of packing and the focus of surgery with our smaller tools allows us to be more precise. It causes less pain. In fact, most of my patients will say they had a little burning in their nose that may have lasted for an hour or two, but afterwards they felt little, if any, discomfort.
How much work do they have to miss?
I do plenty of operations on a Friday and have people go back on a Monday. I like people to consider having 3 to 5 days off from work, because I think it's good for their body to get a chance to recharge, but within a couple of days you probably can return to work.
Do you remove that uncinate bone that covers the opening of the sinus? Do you clip it off? How do you get rid of it?
We have a special tool that you and I have seen in the past on this show that's called a shaver. It's a long, hollow cannula instrument like a straw that has an open mouth on the end of it and a little internal oscillating blade. And it's like a Pac-Man tool, the old game we used to play, and it will sort of nip away the edges of that uncinate bone until it's gone. It's very precise. It's much more precise than the tools we've had in the past, and it has revolutionized sinus surgery.
Mark, I can look at the CT scans of the sinus and I can see the people who've had sinus surgery and how wonderful the drainage is.